Third time's a charm. Okay, my name is Gwen Hall, and I will be talking about why we need to decriminalize all drugs. The war on drugs is, in fact, a war. According to the National Institute on Drug Abuse, over 70,000 people died from drug overdoses alone in 2017. Since the start of the war in Afghanistan and Iraq in 2006, almost 17,000 active duty U.S. soldiers have died. More people are dying from our country's opioid crisis than soldiers we have sent to war. But what are opioids? Opioids are drugs including oxycodone, morphine, and other similar painkillers, which are already FDA regulated. But they also include things like heroin and fentanyl, which are federally illegal. The war on drugs needs to end, and our country needs to decriminalize all drugs. By doing this, we can save money by reducing prison and jail costs and population sizes. It will also destigmatize drug use, so those with addiction problems can more easily seek help and be treated, as well as being able to make safety and health a priority for those who use drugs. Let's start by talking about how much money can be saved by decriminalizing drugs. Our country spends tons of money on prisons and jails. In 2020, over 2 million people are incarcerated in the United States, and almost 500,000 of these were incarcerated on nonviolent drug charges. That more than doubles the population of Des Moines, the largest city in Iowa. According to the Center for American Progress, in 2015, the federal government spent an estimated $9.2 million every day to incarcerate people charged with drug-related offenses. That is $3.3 billion that could have been spent on something much more useful and productive for our country. $3.3 billion that could have been spent on our public school system. Rather than spending it on something else even, that money could have been saved. The United States is at a record-breaking debt of $27 trillion since Donald Trump took office in 2017. If we were to have saved $3.3 billion every year since 2015, we would have saved over $16.5 billion in just 5 years. $3.3 billion wasted on putting drug users who just need a little help behind bars. By destigmatizing drug use, people who use drugs feel more safe and able to go to the hospital or even call first responders in the case of an overdose. One of the first steps to getting better is having a safe and positive environment. So there's a TED Talk by Joanne Harry, and in his TED Talk he does discuss a study with mice. In the study, they gave the mice cocaine water and they almost immediately overdosed. But when the mice were giving a mouse paradise, they were provided with anything and everything they could ever want or need, as well as 2 water bottles, one with cocaine water and the other with just plain water. The mice in this cage never touched the cocaine water because the most important thing for a person with a drug addiction to have is support and happiness, which creates the same dopamine as using drugs. Drug Policy Alliance is working hard to fight the mass overdose rates in our country that our country currently has. If drugs are decriminalized, they are able to create overdose prevention centers. What is an overdose prevention center? Well, it's quite simple. According to the DPA, they offer sterile and controlled settings for people who use pre-obtained drugs under the supervision of trained professionals who can intervene in the case of an overdose or other medical event. They also provide healthcare, counseling, and referrals to health and social services, including drug treatment. Now you may be thinking, won't this promote drug usage? Well, in all honesty, it could. But more importantly, it gives current drug users and addicts a safe place to deal with their issues and try to get better without the risk of overdose. By creating overdose prevention centers, we are also removing the concerns for safety and health issues within the drug community. A huge issue with safety and health with users is clean needles. According to Roseanne Scotti, Director of Drug Policy Alliance in New Jersey, every major medical, scientific, and professional organization that has studied the issue has concluded that sterile syringe access reduces the spread of HIV and other blood-borne diseases. While providing a safe and sterile syringe exchange doesn't promote drug usage, it does prevent the spread of blood-borne diseases, which is a growing issue in drug communities. Organizations that support this issue include the Center for Disease Control and Prevention, the American Public Health Association, and even the American Medical Association. People who do not support this cause are dumb not to. It's such a simple thing, actually. Either you support the spread of HIV and people dying, or you don't. And in my opinion, the better choice is the latter. Now that you know some of the benefits of drug decriminalization, your opinion on this topic may be swayed a bit. We need the war on drugs to end. We need to stop losing 70,000 people from such an easily preventable thing. as well as wasting so much money on incarcerating nonviolent drug offenders. If you want to help make an impact on your country and people's lives, please contact your elected legislators and ask for action now. Thank you all for your time and attention. Now don't forget to contact your legislators.